everyone, welcome back to your PA Mentor YouTube channel, the best place for all things PA. For all you pre-PA students, PA students, and new graduates, we've got you covered. We're going to teach you everything you need to know about the PA profession and how to navigate the first 5 years of clinical practice without feeling burnt out. So, are you ready? Let's get this party started. One of the most commonly requested videos we've had is how to develop your confidence as a new provider. Being a new graduate and working with patients one-on-one can be overwhelming, especially when you have to develop your own assessment and plan. This is why we came up with 5 strategies that are guaranteed to help you build your confidence in your patient interactions. By the end of this video, you'll learn how to be a confident PA that your patients respect and trust. The first tip of building confidence with your patient is to avoid saying things like, I think, or I don't know. There are definitely gonna be times where you don't know the answer to their question and you're not sure about your assessment and plan, and that's okay. But instead of saying, I think, or I don't know, try something like this. The treatment plan for X, Y, and Z is this. However, I wanna double check the dosage to make sure I get it right for you. Instead of saying, I don't know, try this. That's a good question. Give me a minute, I'll be right back. Let me find out the answer for the both of us. It is perfectly acceptable for you to leave the room, do your research, and take as much time as you need and come back with a better answer. Your patients will be very understanding and they will appreciate the extra effort you made into helping them. Do not, and I repeat, do not diminish your role as a medical provider by being insecure about what you don't know. Tip number 2 to building your confidence as a new provider is to be mindful of your body language. When you walk into the exam room, walk all the way into the room. Don't stand by the doorway. Don't have your hand at the doorknob. Sit down, be confident, and don't fidget. Introduce yourself to the patient and to all the friends and family into the room. Get a good understanding of who's in the room with you so there's no awkward interactions later on. Don't tap your foot, chew your pen, or play with your hair during the visit. These all come across as anxiety, insecurity, and fearfulness. Remember, you are the provider. This is your exam room, so take control of the room. Let your body language relay the message. Smile, sit up straight, be confident in what you're saying, and make sure that your patient understands that so that they don't feel uncomfortable with you doing this or, doing this or something like this. It doesn't come across as a confident provider. Now, before I move on to the next tip, if you want to learn more about confidence as a provider, please subscribe to our podcast at Your PA Mentor. I will put the link below so you can check that out. And we talk a lot about confidence in interview and salary negotiation and all things confidence with being a new provider. Also with pre-PA. So check that out if you haven't done so already. It's called Your PA Mentor Podcast. And now with that out of the way, let's move on to tip number 4 on how to build your confidence as a new provider. The next tip is closely related to the last one and it is crucial for developing confidence as a new provider. Be an active listener. Don't spend all your time taking all these crazy notes and charting without maintaining any eye contact with your patients. And don't wait till the patient's done talking so you can jump in and ask them the next question. Listen to your patients, engage with your patients, and allow that to direct the flow of the conversation. One of the most common complaints from patients is that their provider didn't listen to them. If you are constantly asking them the same question and they're having to repeat themselves, they're going to feel like you're not mentally there. So how do you expect your patient to have confidence in your assessment and plan if you're not even listening to them? So pay attention closely. You can jot a few notes down here and there, but maintain eye contact and listen to your patients. The next super simple pro tip to gaining confidence is to follow up with your patients. If you're unsure of your treatment plan, pick up the phone, give them a call and say, hey, this is Sam from so-and-so practice. I'm just following up and see how you're doing. How's that rash looking? Are you feeling any better? This is the fastest and easiest way for you to figure out if your treatment plan was effective. If the patient is improving, great. It confirms and solidifies your plan. If the patient doesn't feel so good and it's not improving, and their symptoms aren't improving, then you know that you can have them come back for a follow-up visit and modify your plan. This gives you feedback, so next time you see the same problem, you'll have a little more confidence in how to treat it. In your first 2 or 3 years, it's all trial and error. You're gonna probably order way too many tests, way too many labs, and that's okay because you're trying to build your confidence. But having that follow through is so incredibly important. So focus on talking to your patients. And guess what? Your patients love this. They love it when I call them and ask them how they're doing because they think that I care about them and that they feel that, I am being thorough. So Take that extra step, learn from your patients. Learn and see if your treatment plan is working, and this will definitely build your confidence as a provider. Tip number 5, the best thing you can do to build your confidence as a new provider is to set and manage the expectations of your patients. Be firm, fair, and consistent. Do not let your patients manipulate you into writing a prescription for an antibiotic they don't need or ordering labs and images that aren't clinically indicated. Almost every patient with back pain wants an MRI, but it is not always necessary. Not every patient with testicular pain needs a urology referral, and not every patient with knee pain needs to be seen by orthopedic. Set realistic expectations for your patients. Don't give in to the demands just because you're afraid to be confrontational and you're afraid to be assertive. Talk to your patients, listen to them, and make sure that you reassure them that you are taking their complaint very seriously and that you will follow up as needed. You can slowly work up the complaint one at a time. Explain to them what you're thinking and how the process works. Explain to them why you're not ordering this test and what it means to order this test. Patients will appreciate that and they will feel like you're listening to them, and that's all that matters. So in my practice, I tell my patients all the time, no, we're not doing this. Here is why. And I would say majority of the time they don't fight with me because I spend that extra time talking to my patients and they feel that I am listening and that I am giving them quality care. And that's the best you can do as a provider. At this point, we reviewed the 5 most important strategies to building confidence as a new provider. I hope you find that helpful, and don't forget to subscribe to our YouTube channel. We will have a new video coming up next week, so make sure you subscribe, and we will announce the topic on our Instagram at Your PA Mentor. And if you haven't done so already, please subscribe to our podcast at Your PA Mentor and listen to all our wonderful topics. Until then, I will see you next week. Have a great day.